think there were only a few specific medications that we talked about. So I think, and they were more, I'm trying to remember what all we talked about. I would be familiar with the Parkinson's, carbidopa, levodopa, because that's a big one that you'll see kind of in practice. I think we talked in general a little bit about like anti-inflammatory medications and steroid use to address, different types of inflammation and chronic inflammation, but I won't ask you about any specific like, Advil, Tylenol, prednisone, anything like that. It'll just be more of that kind of general use of it in relationship to, the inflammatory process and acute versus chronic inflammation.
Okay.
Were there any other meds? I can't think right now off the top of my head.
Thinking about like when we went over, I guess that was an infectious disease with the antibiotics and antifungals and stuff like that, there wasn't it?
Mm-hmm.
So no, not a lot beyond I know the Parkinson's ones because my dad was quizzing my mom. I was like, he takes those, doesn't he? And she's like, yep. Those are the ones that he gets mad that he has to take, and we have to be like, you have to take them.
Yeah, big deal. Mm-hmm. So, yeah, I think that, all the antifungals and stuff and are on the next. They'll be on test 2.
Okay.
Yeah.
Can you go over specific versus non-specific of the immune system? I feel like I just can't find it. I couldn't find non-specific.
Let's see. So do you mean?
Yeah, I think it's like on the antigen. It's like when it binds, but then let me see. I had it up.
I was gonna say I'm kind of looking through that one now. Are you talking about like natural immunity versus acquired immunity, or is it in your textbook that they talk about it in a different?
You put specific versus non-specific immune system, but I guess like I don't know. Is it binding of antibody to antigen is very specific? Is that what you're meaning?
Can you tell me what slide that's on, just so I can read it?
That's on slide 10.
Okay, there we go. That'll help. In the hypersensitivity disorders, is that right?
I thought you were talking about the exam review, but no, I think it's on the secondary immunity, and that's on slide 4 at the bottom when you go into the note.
Got it. Okay. Yeah, I'm wondering if that, so that exam review was left over from last semester, and I just took it and kind of read through it and modified it to fit. And I don't think we went into a breakdown of like specific versus non-specific. And I can tell you that on the test, there will not be a question about the specific versus non-specific. So, I would focus more on, that secondary immunity and kind of what we discussed there with the antigen antibody and how those function. Does that help answer the question anymore?
Yes, a little bit. Thank you.
Yeah. Sorry, I must not have caught that when I went through it. I found it like last thing on Thursday after class. And so people seemed a little bit anxious, and it was a good kind of hot topics. If you're having trouble narrowing down what to look at, this is a way to kind of focus your attention in the material. So. Yeah, that specific versus non-specific must have been left over from last semester, because I did modify this lecture a good bit.
Got it. Thank you.
Mm-hmm.
So are you saying that because I made like flashcards and Quizlets on everything that we went over, and I have like 1 million,
mm-hmm.
But if I'm focused on a lot of this exam guide, that kind of narrows down the information. There's not enough on there. Never mind.
I was gonna say it's certainly not
Yeah.
meant to be. It's certainly not meant to be like this is the only thing to use to study. But you know, I was kind of getting the feeling that people were fairly anxious about this test, and so maybe because it is a lot, like especially the nervous system and the nervous system disorders is a lot of material. That it may help some people to say, okay, you know, I'm just gonna to help myself kind of feel a little bit more at ease. I'm gonna, you know, go through this and I'm gonna make sure that these are the topics that I know solidly, because some people have a hard time prioritizing material. But again, it doesn't mean that everything on there is all that's on the test. I mean, anything, of course, from the text and the lecture material is fair game. But you know, it was meant to kind of help people narrow things down a little bit and feel like, you know, okay, these are topics that she has said are important. And so I know that this material could show up and I want to be, you know, I want to feel solid in these things.
Okay.
Do we need to know where the arteries, the cerebral arteries go to the parts of the brain?
You want to know, you want to have a basic knowledge of what they supply. So, you know, I'm not going to expect you to say, you know, they go to this sulci and this, you know, particular tract and that kind of thing. But should you be aware that, you know, the middle cerebral artery will provide blood flow to some of the frontal lobes, some of the temporal lobe, some of the occipital lobe? Yes. Should you know that the anterior cerebral artery supplies the frontal lobe? You know, that general kind of awareness of where those major arteries supply the brain is important in relation to stroke. So yes, that is how I would look at it.
Will that also tie into like impairments if there's disabilities, or we need to know what artery or where the injury may have occurred?
Yeah, so you you know, you want to know kind of the general function of the lobes, right? And then you want to know a general, you know, kind of where those major arteries supply blood to the brain in relationship to the parts of the brain. You know, and then we talked about that motor and sensory homunculus and how that would help us to determine what impairments you would see in a stroke. So, you know, you could see a question that says, you know, this patient presents with, you know, a middle cerebral artery stroke. You know, what impairments do you expect, or what impairment do you not expect? Or you could see the opposite. This patient presents with right upper extremity weakness, or right-sided weakness. The arm is weaker than the leg. What type of stroke could this be? So, you know, it could be worded in a couple of different ways to show that you have an understanding that different arteries supply different parts of the brain and that different strokes show different impairments based on what part of the brain is affected. And I think we had a slide in the neurological disorders material that went over kind of the major arteries and what their impairments tend to look like. And I think there's a table in your book as well about that. Yeah. So slide 5 in that lecture material kind of talks a little bit about those arteries. And then I think too in the nervous system, we had a whole slide about each artery and what areas of the brain they supply. So yeah, that was slide 16. What other areas is everyone
What about like the
struggling with, or have you heard? I'm sorry, say that again.
The spinal cord syndromes, like the.
Okay.
Do we need to go into detail about those for the test?
So you want to have an awareness, so that, or you're talking about the incomplete spinal cord injuries, right?
Yes, the slide after that.
anterior. Yeah. Hang on, I'm looking at it right now. So for spinal cord, yeah, so it's important to understand, based on where that spinal cord injury is, what deficits may be seen, to kind of help decide what kind of treatment plan you're going to use with that patient. So, and in your medical history, you're going to get a history that says, this patient is a T12 Asia, B, anterior cord syndrome. And so that tells you a lot of information, right? It tells you the level of injury, it tells you that they're an incomplete injury, and it tells you that the majority of the tracts that were affected were on the anterior part of the spinal cord. And so by receiving that information, you should have an idea of what you may see with that individual. So with an anterior cord, based on where those spinal tracts are and how they fit, what deficits would you anticipate? So if you think about that cross section of the spinal cord, and you think about your dorsal columns or your sensory, so the back of the spinal cord is mostly sensory, the anterior portion is mostly motor. They've injured the anterior portion. So that means your motor is going to be impaired, right? They're going to have loss of mobility, loss of muscle function below the level of the lesion, but they're going to have intact sensation, right? Because the back of the spinal cord, the posterior part of the spinal cord, remained intact. So kind of a general understanding like that. I'm not going to ask you, what tracts are affected, and I'm not going to ask you to name the tracts, but to understand, where the location, just like stroke, where the location of the injury is, and be able to say, okay, if it's a if it's a half of the spinal cord injured, like in a Brown-Séquard syndrome, or the posterior cord injured, I can expect them to have these deficits. Do you guys understand, like, when we talk about which part of the spinal cord, like when you look at that cross section in slide 30, have you all gone over that in a class before, where you've looked at the spinal cord and the tracts and what's sensory and what's motor? And
we've talked about it, but I don't remember us looking at it and labeling it and really grasping. I mean, it's like a memory thing. Like, we know the dorsal horn does this and da 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 da.
Yeah.
So it's kind of hard when you don't really visualize it. So I'm struggling with that one myself.
So you're trying to apply it is.
Yeah.
Yeah.
Okay.
I mean, I can memorize stuff all day long.
Yeah, I don't want you to memorize it, and that's it's what we want. We want you to have a good understanding of it. So I wish I could draw a little bit better, but so if you have your spinal cord cross section, okay, and your spinal cord runs right from the base of your brain, at the brainstem, down to around L2, right, where it turns into that cauda equina, and you've got all those different spinal nerves coming out in the sacral region. All right, so at each cross section, so the spinal cord's running up and down like this, at each cross section, that's what we're looking at in slide 30. Is a cross section of the spinal cord. So each level would look very similar if you cut it straight across. Okay, and those tracks, those colored areas, the blue and the red, those are symbols for tracks that run up and down. Okay, so they run from a motor or a sensory nerve into the spinal cord, up the spinal cord, and into a part of the brain that innervates that area of the body. Does that make sense? Kind of. Yeah. So you're still kind of getting a little bit of a, okay.
I think so. I think maybe. So
maybe tomorrow I can draw it a little bit on a board so that we can kind of talk about it a little bit more. Can you
know?
You can't see my drawing very well. No. So if this is our foot, right? And our foot has a sensory and a motor nerve, okay? And that's going to run in. So you're going to have your foot, it's going to run into the spinal cord. It's going to connect somewhere with an interneuron. And then that information is going to run up a tract along the spinal cord into the brain, okay? Those tracks, those blue and those red areas on that cross section are symbolizing those tracks. So those tracks run vertically. Okay. So if we injure our spinal cord, a Sharpie is what I need. And say we injure, if this is dorsal and this is anterior, I'm going to show you this in a minute. All right. So this is a really ugly picture of our spinal cord. That looks like a butt. But if this is our spinal cord, and this is the dorsal part, and this is the anterior part, and we injure here, okay? So whatever, the patient has a fracture of the bone and they injure the back part of that spinal cord. Okay, that's where your sensory pathways are, right? So if you look at that cross section, so you can look at that and you can say, okay, my motor information is intact. So they're going to have motor function below the level of the injury, but we've damaged my sensory area. So they're not going to have from that dorsal column proprioception, light touch, 2-point discrimination. So that's how you can look at it, right? Okay. So then if we were to injure the front area, right here instead, okay, we've lost our motor, so they're not going to have movement below the level of the injury, but they can still feel because this has remained intact. Okay. All right. When we talk about a complete injury, everything is gone. All the tracks have been split. That is a complete injury. So there's nothing, right? There's no information coming from the brain to that level of the injury. It can't pass through. So we've lost all sensory and all motor, and that's what complete means. Does that help?
Absolutely.
Yeah. Okay.
Yes. Thank you.
So if I can ask a question about that, if there is, so you're wanting us to just get a overview of that, or as the semester goes on, will we kind of tease out specifics? Is this more of like a 30-foot view kind of thing?
This is, this is the only time we touch on spinal cord injury this semester.
Okay.
Unless we hit it a little bit in like geriatrics or ICU, but we won't go into any detail
okay.
in those sections. You will hit spinal cord injury again with Miss Martin. I think in procedures 4, she goes into a lot of spinal cord injury, and you'll go into a lot more details there. But she'll want you to have an awareness of these basic syndromes. So these are kind of the most common spinal cord injuries that you'll see. And so, you're either going to have a patient with an incomplete injury or a variation of one of these syndromes, an incomplete injury. So, I'm not going to ask you what tract is damaged. Like, I won't have a question that says, please name the tract damaged in a Brown-Séquard injury. That's not how it's going to be. But I could ask you, this patient has motor function below the level of the injury, but does not have light touch and proprioception. What kind of spinal cord injury is that? Okay. So you could say, okay, that is a posterior cord syndrome. So it'll be more of a generalization so that we know, okay, I understand that if the front or the back or the side of the cord are injured, this is what I could or could not see.
Okay. And will we get also and I think we're going to do that tomorrow, but like case studies where we will hear more. Okay. Because I think that too kind of puts things together when we hear about patients that come in that have X, Y, and Z. Okay. That instead of just reading it straight from a textbook, it kind of gives like a patient type symptoms or issues.
Yeah. So tomorrow I've got, it's pretty loose because I want it to be interactive. So I want people to kind of help to discuss these things, but I've got 4 cases One is a wound to talk about healing and inflammation. One is a spinal cord injury. One is a stroke. And I can't remember for the life of me what the last one is right now. And then I've got some kind of predetermined questions that will help us go through some of these areas that I feel like people may be struggling the most with tomorrow. So hopefully that will help too, to kind of apply it to a specific patient case. Yeah.
Are we meeting in the auditorium tomorrow?
We are meeting in the auditorium tomorrow. I just found out like 20 minutes ago. So that'll be very helpful. And I think we may have the auditorium from now on, class, unless there's like a special event. So I don't know the rules yet, like how far apart everybody has to be and what doors we have to go in, but we are supposed to be in the auditorium tomorrow, which will be very nice. The only thing that we're worried about is apparently the internet is not great in there. So I'm hoping we can get everything loaded up. I don't even know what the auditorium looks like. I've never been inside before. So it may be a little bit of a slow start, but we'll get there. It'll be a lot better than being in multiple places. So, yeah. Any other?
So are you saying tomorrow we're going to have more time to kind of review?
Yes. Tomorrow is all review. We're not doing new material tomorrow.
Perfect.
Yeah.
I really need that. I think because it's just been lecture and I'm like a more visual hands-on and kind of person.
Yeah.
So that would be really helpful.
Yeah, this class is all, because we don't have a lab, this class is all lecture. So it's, you know, it's a lot of memorization. It's a lot of, you know, reading and kind of getting into, you know, the textbook a little bit. And so that's harder, you know, for PTs and PTAs, because we just tend to be physical people. We, you know, we want to move and touch and feel. And so, but, you know, you're going to take this class and you're going to go on to some of your other classes and you're going to be like, that's what we talked about in patho. That's what she meant. You know, okay, I get it now. You know, when you start applying some of these treatment techniques and patient cases and modalities and vital signs, it'll all kind of come together. I was going to say, I think, you know, I mean, the exam is very evenly, it's pretty evenly distributed. So, you know, I mean, we spent 2 lectures in neuro. So of course there's going to be a lot of neuro questions. Some of them are, you know, just straight up definition. And this is for all of it. Some of them are just straight up definition. Some of them are, you know, application. So there'll be kind of a patient scenario that you think about. There's a couple of questions towards the end that are like a patient case with 2 or 3 questions that go along with it. And that's just to mimic the board exam as well, because you'll get those kinds of questions in the board exam. I think it's important to remember anytime you take a test, especially multiple choice, is to choose the best answer. So there can always be more than one right answer, but you want to make sure that you read the question and make sure you're answering it, you know, whatever answer you choose is the best answer for that specific question. There's always a keyword in there that will tell you which one is the right answer. So yeah, but it's fairly evenly split, you know, along the material that we've covered so far.
Is there a way that you could open up the quiz for, I think it's quiz 2? We can't see our answers. Like, I think I've tried to go back and I just wanted to look at them, but I can't go back for some reason.
Like on Blackboard?
Correct.
I can look and see. I can try. I'm not positive once the grades have come through, but I can certainly look and see. And I'll probably, if I can make it work, I'll see if I can do it for like a short period of time, because those quizzes are reused, so we don't like them to be, you know, able to be written down and that kind of thing.
That's what they've told us in the past, that we're not allowed to have
to go back in and look at them again. Okay, yeah.
I think they'll go over them with us, and that's the time that when you go over them to either write things down or what have you.
Yeah.
Because they do reuse them from semester to semester.
Exactly. Yeah.
Okay, thank you.
Miss Prado is hardcore about that too. The only time we get to like see our exams is if they're like sitting there with us, like after we take them. So might
Yeah.
want to get used to that.
Yeah, that's good to know. Yeah. So, because we do, and it takes a lot of time to make an exam and a quiz, and so it is, nice to be able to kind of reuse it or change, a few questions here and there, so that you're not having to. A 45 question exam takes a long time to put together. So
Is that how long our exam is?
it is 45 questions. Yes. Yes, it is. Yeah, so normal cell through the immune system. So lectures 1 through 5 are all on there. And then the 4 cases tomorrow, I can post those on Blackboard. I have them written up, so I'll do that tonight once I get off of here with you guys. But I think that will help too tomorrow, is going over the cases and just applying it to some of this material. So yeah, so there's 1 fracture case, 1 wound case, 1 stroke, and 1 spinal cord injury that we'll talk about tomorrow. Yeah.
Well, I know we have the review tomorrow, so I know you don't want to go through everything. Does anybody else have any other questions or anything specific that you want to ask?
I just have to study a whole lot. That's it. Memorize.
You'll get there. Do you all have other tests this week, right? Or is that cohort 1 that has other tests this week?
No, we had an exam last Thursday, but I don't think we have one this week.
Okay. So
We have a quiz
This one.
Thursday
Okay.
Which class, Bethany?
for 160.
Oh, okay.
All right. Well, if you think of any specific questions, write them down. I'm hoping we'll have a little time at the end tomorrow to go over them. Feel free to bring your lectures and your text tomorrow, because I don't want it to be me just talking to everybody. I want it to be an open discussion. I think that's going to benefit everyone better if you're talking about it and I'm kind of filling in the gaps. I'll put the cases on Blackboard in just a minute, and then we'll have that review tomorrow. All right.
Well,
Thank you.
good.
You're welcome.
you.
Thank you.
Thank
Have a
you.
good night.